Welcome everybody, with you Dr. Magdi Abdelrazik, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about explanation the symptoms and the stages of syphilis. So, syphilis is a bacterial infection, primarily transmitted through sexual contact. The infection is characterized by several stages, each with its own set of symptoms. In its first stages, known as primary and secondary syphilis, symptoms include skin sores, rashes, and flu-like symptoms. These first stages are followed by a latent stage in which the syphilis infection is still present but does not cause any symptoms. Without treatment, the disease can progress to the tertiary stage, where the infection can damage the heart, the brain, the blood, the vessels, and other organs, and rarely lead to death. While the rates of syphilis are increasing among all age groups and in both men and women, there has also been concerning increase in rates of congenital syphilis. When an infected pregnant person passes the disease to their child during pregnancy or childbirth. Despite the rising the incidence, syphilis can be effectively managed with antibiotics. With early detection and treatment, syphilis can be cured before it causes irreversible damage to the organs. If the disease progresses, antibiotics can clear the bacteria infection from the body. However, damage to organs may be permanent. It is important to note that not only is treatment advantages for the infected individual, it helps the public health goal to decrease transmission to others. So, syphilis uh, most often transmitted via sexual contact. It is characterized by progression through several stages. Primary syphilis typically characterized by single painless sore called chancre. Secondary syphilis often marked by skin rash, swollen lymph nodes, fever, and patchy hair loss, among other symptoms. Latent syphilis, a period that may last for years or even decades, in which the infection is present in the body but does not cause symptoms. Tertiary syphilis, which occurs years and is characterized by damage to organs and other parts of the body, including the heart, brain, blood vessels, and also the brain. At any stage of syphilis, the infection can affect nervous system called neurosyphilis, eyes and disease called ocular syphilis, and or ears. This is called otosyphilis. So, syphilis is caused by a bacterium Treponema pallidum, which is primarily transmitted through direct contact with syphilis sores or rash during sexual activities, including vaginal, anal, and or oral sex. In addition to sexual transmission, an infected mother can pass syphilis to her unborn child through the placenta during the pregnancy or during childbirth, through contact also with sore or rash, resulting in a condition known as congenital syphilis. It can non be congenital. It can also be transmitted through blood transfusions, through routine screening of donated blood limits this risk in the all over the world. Syphilis is not spread through contact with objects touched by an individual with the condition, such as a toilet seats, door knobs, swimming pools, bathtubs, or shared clothing or eating utensils. Syphilis can be transmitted via sexual contact during primary, secondary, and early latent infections that occurred within the previous 1 year stage. During the late latent and tertiary stages, syphilis cannot be transmitted through sexual contact, so it can still be passed from a pregnant person to their fetus. People who have been infected by Treponema pallidum can no longer transmit syphilis to others once they complete their treatment and any sores have completely healed. So each stage of syphilis has its own symptoms. Primary syphilis symptoms of primary syphilis, which can appear 3 to 90 days after exposure to bacteria, include a chancre as the infection site, often on the penis, vulva, or vagina, but it can appear on the cervix, anus, rectum, lips, throat, hands, perineum, the space between the anus and the genitals, or other parts of the body. Less commonly, there are multiple sores. Sores are usually firm and round and typically last for 3 to 6 weeks before healing on their own. Secondary syphilis, the symptoms of secondary syphilis, which usually begin about 2 weeks to 3 months after the initial appearance of a sore, include skin rash that typically does not itch. It may be widespread or restricted to a localized area and can develop on the palms of the hand or the soles of the feet. Sores, known as mucus patches, may develop in the mouth and or on the tongue or genitals. It is called condyloma lata. It is raised, grayed, or white lesions that can develop in the moist area, such as the mouth, genitals, anus, and armpits. Flu-like symptoms including fever, sore throat, fatigue, and muscle and or joint aches. Weight loss, patchy hair loss may affect scalp, eyebrows, or beard. Headache, swollen lymph nodes, uh, all these symptoms can affect secondary stage syphilis. Thank you very much.